Hi, everybody, and thank you for joining us. My name is Drew Armstrong, and I'm the executive editor here for Endpoints News. Welcome to Post Hoc Live. If you are joining us for the first time, hello and welcome. What is this and why are we doing it? Well, a big part of what makes Endpoints News special for our readers is that we have expert journalists here covering complex topics. And as the news cycle has sped up over the last few months, thanks to the Trump administration, it can be really hard to keep up. So our reporters spend every day talking to sources, texting, calling people, reading executive orders, talking to each other in Slack. And we wanted to bring you more of that analysis that we get inside the newsroom, take it from behind the scenes and put it right in front of you. We're going to bring you up to the minute conversations about how we think about the news and hopefully let you be a part of it as well. It's an extension of our analysis newsletter, Post Hoc, but streamed live. And in the weeks and months to come, we'll be firing it up in response to big news like pharmaceutical tariffs, like we did last week, or a newsy week like this one with a major appointment at the FDA. If you get our Post Hoc Live newsletter, you'll get alerts to know that when we're doing this. You can also find us on endpoints.com, and we stream across YouTube, X, and LinkedIn. So let's talk about what's going on. We are recording this on May 7, the day after the surprise announcement that the FDA's new head of CBER, that's the Center for Biologics Evaluation and Research, will be the academic critic and YouTube streamer and podcaster Vinay Prasad. That news was, to put it mildly, a real surprise to a lot of people. I mostly know Prasad from Twitter, where years ago he made his name for himself tearing apart shoddy drug trials. He was a journalist friendly, really smart, skeptical researcher who had an eye for a bad study. And then something got a little bit different. I think this happened to a lot of people who were really online during COVID, and he began to focus on the pandemic with some legitimate criticisms, but also became one of these really online commenters who weighed in just about on everything. He has attacked mRNA tech. He's talked a lot about rare diseases. He reviews movies on his Substack. He's a little bit all over the place. And now he is in one of the FDA's most important jobs. And people think that he might do that job in a very, very different way than his predecessor, Peter Marks. So we're going to talk about that today. Joining me is Zach Brennan, who has covered the FDA for years, who has known Prasad on and off for a long time, and broke this news yesterday for us. Also joining us is Lei Lei Wu, another of our journalists. She's an expert on cell and gene therapies and has written about the drugs and the companies that seem most vulnerable to the types of changes that people think Prasad is going to bring. So welcome to Post Hoc Live, Zach and Lei Lei. Thanks for being with us. Zach, I want to start with you. I mean, like, you've known Vinay for a while in a lot of different capacities. So, like, who is this guy? I mean, I think for people who don't spend as much time on Twitter or on YouTube, or as journalists, and might not know, like what is his background and his history, and like how did he become the guy that I think we all know a little bit more about now?
Yeah, so I think as you mentioned, he's an oncologist, hematologist who has kind of stayed in his lane for a long time and really focused on cancer drugs and cancer drugs that maybe showed minimal efficacy or smaller amounts of efficacy than he was hoping for. And he kind of made a big name for himself as a critic and as someone who was very kind of critical of the FDA for being too loose around some accelerated approvals. And then, yeah, I mean, as you mentioned, he just kind of dug into COVID. And I think that's where a lot of us kind of stopped talking to him and following him so closely. But I mean, yeah, from what we're hearing from within the FDA, it sounds like, people are very fearful slash, kind of questioning what he's going to do, how he's going to act, how boisterous his personality is going to come out as CBER director. But we'll see. I think there's a lot to be seen. Yeah.
Yeah, and I mean, he was someone who, I mean, my recollection was like he was, like a very journalist-friendly guy. Like he was someone people used to call for quotes or to help them unpack a study. I mean, I think like a very much like a respected, thoughtful voice.
Yeah.
And like I don't know. I mean, I always thought of him as this great resource for spotting BS. During that time of his career.
Totally. And I would say he was super responsive. He was always willing to give you a quote. It was always like a little bit of a flashy quote that you were happy to use in an article because, he obviously knew what he was talking about. And um, but yeah, I don't, we'll see kind of how this translates into his work. I mean, going from a Twitter commentator to director of CBER is a big jump, and he's going to have a lot of responsibility.
Yeah, and it's interesting. And Layla, I want to turn to you here because like he's not been shy about commenting on a lot of stuff that's outside his lane. I know you were covering the Sarepta earnings last night, and he's been this big critic of their gene therapy, right? Like he's like, will you remind me what he's said about that? I mean, he's basically said this never should have been approved, right?
I mean, I think he's been a critic of sort of Sarepta's approvals even before the gene therapy decision. And I think a lot of people, you saw the stock reaction yesterday. Sarepta's stock fell 25% before they even reported earnings. And he has been incredibly vocal on Twitter, on his, I guess, own newsletter of how he doesn't agree with Peter Marks
What's his beef with them? I mean, is it
on
just, I know there's a lot of
the
criticism of this
FDA's
trial, but like,
decision.
what's the issue?
And I would caveat this first by saying that he's not alone in
Yeah.
disagreeing. We saw the FDA's own staff reviewers disagree with Peter Marks on this decision. And these are some of the most controversial decisions the FDA has made in like the past decade-ish. But essentially, his argument, and I think this is the crux of a lot of his arguments against some drug approvals, is that the evidence isn't there. That this drug is, I think he once called it like a useless drug on Twitter or something like that. And the company is charging like $3 million for it. And so I think he has criticized Peter Marks for sort of being a pharma shill for approving like Sarepta's drug specifically.
Yeah, I think the thing that he posted online was you could replace Peter Marks with a bobblehead doll that just stamps approval, and you'd have the same outcome at FDA with lower administrative fees. And obviously now he's going to be in Peter Marks's job, but I like, yeah, that gives you a sense of what he thinks about. I think that role that people are trying to make sense of, like what is this FDA going to be, and is there going to be a coherent philosophy around what type of data is going to be required to get approvals or accelerated approvals done? I think that's been hard to parse, right, Zach?
Yeah, I mean, he certainly has taken a stand that he is strongly in favor of randomized controlled trials, and he's strongly in favor of using placebo or using controls in some way. He's certainly come out against like using single arm trials and against like even smaller trials. I think, and certainly he's very strongly in favor of kind of relying on overall survival in a lot of these trials. So again, I think also just taking a step back, right? Like CBER director doesn't typically involve themselves in like the minutia of reviews of drugs, right? We saw Peter Marks overrule his reviewers with Sarepta on that one occasion, but like they really don't do it more than say like once a year, once every couple of years. So the extent to which he's actually going to be like making decisions on drugs or overruling reviewers, I think, is probably not going to be as much as maybe the market overreacted for.
Well, and like I think you bring up a really interesting point because like he's been a critic of senior FDA staff overruling the reviewers, right? Like he's come out and said like, I think that's bad, right? Like what has he said about that?
Yeah, exactly that. That like, it should all be data driven. It should be, objective reviewers, which career officials at the FDA are the ones who typically review the drugs and review the data. And yeah, he's been kind of a strong proponent of making everything very data driven. So I guess it'll be interesting when some of these rare disease companies that have already agreed with the FDA on using a single arm trial or using what they think is an ethical number of patients in their trial, and he kind of, we'll see if he kind of lays down the law and says no, this isn't enough, or how involved he gets in those individual decisions, I think,
Yeah.
kind of remains to be
Yeah,
seen.
and I will point out that there's like a little bit of conflict or confusion here, because Peter Marks was obviously very in favor of sort of speeding these rare disease programs. And McCary has sort of come out and said similar things, like he
Right.
wants to help these programs get to patients as fast as possible.
He said like if there's a plausible mechanism, they might do it on like a conditional approval, right? And give them,
Right,
yeah,
right.
essentially like making this even faster than what Marx was talking about, like stepping on the gas on that is my impression.
Right. And like Prasad has, said a lot of positive things about McCary, but this is one area where they seemingly don't agree, because he's all about the sort of gold, quote unquote, gold standards, that we've seen from, like as Zach said, like randomized controlled trial, placebo controlled, et cetera, et cetera.
Well, and I mean, like that just hasn't been the approach that a lot of like the rare and ultra rare and cell and gene populations really taken, right? Like, I mean, I think like correct me if I'm wrong here, but like a lot of these companies have kind of walked in with the assumption that it's going to be very hard to run a placebo-controlled trial for, a tiny patient population. And that has been kind of the governing philosophy around these diseases and these therapies now for several years. It kind of seemed like we were only headed in one direction, despite all of the criticism of the Sarepta approval.
Yeah, I mean, I think a lot of these companies, a lot of the patient advocacy organizations have been saying this for a really, really, really long time, that like we don't have enough patients to possibly run like a placebo controlled, like randomized controlled trial. And then it felt like under Peter Marks, they were finally gaining some momentum there, that like to them, it seemed like somebody was listening to these concerns that they had. And then you saw like a lot of these companies have now agreed on these sort of single arm trials. So I think a lot of the companies like Ultragenics, like PTC, like had their stocks fall yesterday because people were just like, we don't know if that's still
Right.
a possibility for these rare disease companies, under Prasad.
Yeah. And well, I mean, and I think, going back to something we were talking about a second ago, like it's really hard to parse out like a coherent regulatory philosophy. And we always hear companies talk about we want certainty, we can adapt to certainty and things like that. And like I think you have on one hand, an RFK school of thought where I think there's, obvious stated skepticism of the drug industry. And then you have, what seems like you could take away from this, McCary comment saying, okay, we're gonna speed this up and be deregulatory. And, it's more complicated than that, obviously. And I think, Zach, we've chatted about some points here that like there probably can and should be different standards for different types of drugs, but it does seem like, Lei Lei, as you point out, like there's some real meaningful differences in approach here. I don't know, Zach, can you like, is there a good way of kind of parsing this and, say, hey, we need these standards for these drugs, these standards for these drugs, like can and should these things be different? What do people think about that?
I mean, I would say we definitely saw Peter Marks really pushing hard to use accelerated approvals for some of these new gene therapies and some of these other therapies that maybe wouldn't have initially been thought could be used or could be, approved through the accelerated pathway. And yeah, I think, just based on what Vinay has said in the past, like I think a lot of those might run into more hurdles than they would just because he has been so adamant across his, academic career and in what he posts online and in his articles and things that like we need to be more rigorous and that there are standards that we need to abide by and patient voice isn't what it should be and I think that is kind of creating a lot of this fear.
Yeah. Well, and I think one of the things that seems to be true across this administration is that a lot of people who get picked for roles are very online and, and post a lot and kind of have this very, almost Twitter filtered worldview. And, for better or worse, the way that people in that sphere seem to rise to prominence is by being, conflict prone or, oversimplifying viewpoints or exaggerating. And it gets really hard to pull out, I think, what they actually think from that. Are they the people that they say they are on Twitter? And, you mentioned some of the overreaction that, you think we're maybe seeing here, or is there some kind of more moderate, coherently organized person underneath a very online persona? I mean, do you think people are do you get a sense that people are, saying, hey, there's an overreaction here. This guy's maybe not as out there as like a YouTube short would suggest?
Yeah, I do. I think, and I think when we think about Trump appointees, we focus kind of on is he anti-vax? Is he gonna do things that say a normal MD wouldn't do? And I think Vinay will, I do think he'll kind of surprise people in that respect. I guess I think back on when the oncology adcom at FDA was, bringing up all these dangling accelerated approvals, which were accelerated approvals where they either hadn't run the confirmatory trial or the confirmatory trial had failed. And he was, sending me Twitter messages constantly saying they should have pulled these. They never even should have had this adcom. Like, if you fail your confirmatory trial, boom, you should be gone. And that drug should be pulled from the market. So, it's hard not to think that, big biopharma companies would be opposed to that necessarily. But again, how much sway he has as CBER director and how much, decision-making authority he will kind of wield, I think, is yet to be seen.
Yeah. Lei Lei, I mean, what were people, you listened to the Strepta call last night where, I mean, they just got nuked by this thing. So like, but what were they saying about it? I mean, because it's interesting because, they're the first company to report earnings and get asked by analysts, like, hey, this giant piece of news just happened. It took, I think, like $2.6 billion off of their market value in just a few hours. I mean, pretty, that's as bad as it gets, certainly without failing a major trial in biotech. What were they saying? What were they being asked and saying about this last night?
Mm-hmm. I will caveat that the 2.6 billion was also because they had missed on
revenue. They had other bad day on Wall Street.
They had other things going
on.
But I mean, they like didn't comment. Like, their CEO was like, I'm not going to comment on like specific appointees. But he said something along the lines of like, we hope the FDA will continue being the FDA it's been for like the past 100 years. And their drug also, I think is worth noting, has regular approval already for patients kids who are ages 4 through 5, I believe. So something like that would be much harder to pull than, say, like an accelerated approval, which is what the broad label is. And that was a decision that was made by Peter Marks. So I think there is some like, maybe not overreaction, but there is some like immediate like knee-jerk reaction to news.
Right. Yeah. Which, I mean, that's kind of the world we live in, right? I mean, I think that's been the dynamic of this entire administration and the last version of the Trump administration, is that someone, either has said or says something very extreme and everybody reacts in a really big way. And then reality sets in a little bit that, okay, maybe it's not going to be, yes, this is really different, but maybe it's not quite as different as we all thought it was. So, I mean, Zach, like, okay, he's CBER director. Are there limits to what, how much kind of institutional inertia or limitation is there in this role? Or can he just kind of do whatever he wants? I think, like, when we think about the power of this role, like, what power does it actually have, and how is that exercised in the real world when the rubber hits the road?
Yeah, I mean, I think, as Lei Lei said, like, is he going to come in on day one and start pulling approvals for drugs that he doesn't agree with? No, probably not. And that probably wouldn't be a priority for him. But he can certainly set up, as we saw Peter Marks kind of, he went after stem cell clinics that were a little bit dubious and kind of made that a priority for him. And he really called out rare diseases and tried to increase accelerated approvals. So, like, there are certain policy things I think he can really dig in on. But yeah, I mean, the idea that he's gonna, like, all of a sudden be like helping review teams on individual product reviews, I think, I mean, I guess we haven't seen it yet from a CBER director. That I guess there's It doesn't mean that it won't happen, but I think that's less likely that he's going to have like kind of a day-to-day like hand-holding experience with the review teams in CBER, and he's going to like, really dig in on all the products that are under review. But having said that, if he kind of, announces, hey, this is my priority, like RCTs or bust, like, I think a lot of companies are going to take that to heart. I think a lot of companies do listen to what these leaders say and really try to adhere to what they're doing as much as, the laws and the guidance and regulations are already kind of established. Yeah.
And
Where
I
has
feel like
he? Oh, sorry. Go ahead, Lei Lei.
Sorry. I feel like it's worth pointing out that like this is a position that's not typically like a political appointee kind of thing, like the FDA commissioner is. Like this is supposed to be like a career FDA official who is overseeing CBER. So I think his appointment is like a little bit out of the normal in that sense.
Yeah, I agree. I think it does seem way more political than it does.
Yeah.
Like, is Vinay Prasad really going to spend 20 years at the FDA working as CBER director? Probably not. Like, maybe, but
Well, yeah.
unlikely.
No,
Yeah.
I mean, like, and I know there was, I think, we were chasing a rumor that didn't pan out that he might have been up for an actual political job in the administration a couple of weeks ago, which I think nothing, I don't think anything actually came of that. But like his name has been kicking around on a somewhat political basis, I think, for a while, and so yeah, I think that's an interesting and probably correct perspective that he, like, yeah, they didn't pull someone off of a, research lab, at some university doing this. I mean, like he is, I think, first and foremost a voice more than, and more than anything. Lei Lei, I wanted to ask you, I mean, it's been interesting to watch, companies like Moderna, which is, maybe more closely aligned with mRNA technology than just about any other biotech company out there. I mean, like they've had a rough go in this administration because of the skepticism of the vaccine folks, and the anti-mRNA folks and the kind of Kennedy camp. And then I think, Prasad has been out there saying, I think pretty, forcefully that mRNA cancer vaccines don't work. I mean, we talk about his prejudging some of these decisions. Are there other technologies or comments, or even just thinking about that one in particular, where we've seen a lot of a lot of voice around specific products, in addition to Sarepta or this one, where clearly he has a point of view about what works and what doesn't, even though we haven't seen the full data on these things yet.
I mean, I would say that I think most sort of controversial FDA decisions, he has been on the side of like, oh, like that doesn't work. With Aduhelm for Alzheimer's, for example, like he was of the camp of like, no, that doesn't work.
Yeah.
And maybe Zach is more familiar because I know you covered that. Maybe you're more familiar with what he said around that.
Yeah, again, I think, he saw that first failed trial, and then they had the other trial that seemed to work, and then they kind of reworked the data to a certain extent. And I think, he seems very anti like data dredging or, post hoc analyses. But yeah, I mean, I guess we'll see. Again, it's really kind of, it'll be interesting to see kind of how like controversial decisions are made under him and whether or not he will step.
We should have him on the on Post Hoc Live here, and we can ask him. We can ask him about that. So if you're listening, that's an open invitation. We do have a couple of questions from the audience. Hey, thanks everybody for weighing in the in the chat. I think one of the questions is, do you have any thoughts on his managerial manner as he sets in? And I think we know, he's been an academic and he's been a voice, but I think like a lot of people in this administration, he doesn't come from any kind of big administrative capacity or, leading some giant lab or some big organization in the past, right?
Yeah, not that we know of.
Yeah.
I guess that will be, it'll be curious to see kind of how he manages, because the bureaucracy at the FDA is very thick, I think, as everyone knows, right? There's like division directors and assistant division directors, and they're all going to be reporting to him. So yeah, it'll be very interesting to see like kind of how he works with some of those people and who he brings in and how that all plays out. Although, having said all this, right, like CBER is much smaller than CDER, and I think everyone kind of thinks of, oh, drug approvals are all kind of in the same bucket, but he really will only see like a small fraction of
Right.
the approvals. Yeah.
There's a lot. Yeah, you mentioned this to me when we were prepping for this. Like, there's a lot of stuff that he has an opinion on that he doesn't actually touch in this role, right? Like, will you remind me what some of that is?
Yeah, well, I mean, I guess all the like COVID antivirals that he thought were totally bunk, like those aren't under him. All of the, even Aduhelm that went through CDER, that wouldn't have been under him. The Sarepta, some of those drugs would have fallen under him, as we saw they fell under Marks. But
Well, I mean, a lot of the oncology medicines are not under him either, right?
right, and I think a
which
lot of
is
the ones that,
ironic given his expertise. Yeah.
and a lot of the ones he's taken issue with in the past were either approved by CDER or, they didn't go through CBER. So
Right.
we'll be interested. Yeah.
Okay. Well, I think that's gonna about wrap us up for today. So a big thank you to you, Zach, and you, Lei Lei, for joining us. For our audience as well. I know there've been a lot of people who dropped questions and thoughts in the chat. Thank you very much. My name is Drew Armstrong. I'm the executive editor here, and thank you so much for joining us on Post Hoc Live. The recording of this conversation will live on YouTube. If you search for Endpoints News in YouTube, you will find our channel, or you can go to endpointsnews.com, and you will see it right on the front of our website right now. If you've got any feedback on what we're doing, send me a note. I'd love to hear from you. And in the future, we're planning to have guests from outside the newsroom. So if you have a great idea for a guest, or if you should be one yourself, please reach out. Second to last, if you're not signed up for our Post Hoc email newsletter, which will give you alerts about our next broadcast, please do so. You can go over to endpoints.com, and then in the top right-hand corner, you'll see your reader profile. Click on that, click on preferences, and then find Post Hoc and activate us. You can follow us on Twitter, LinkedIn, YouTube, and Blue Sky by searching for Endpoints News. A big thank you to the folks behind the scenes, our producer, Nicole Wetzman, and our engineer, Dalen Turk, who make this whole thing work. We will see you next time. Thank you again for joining us.